Aaron Coaching. I'm so glad you all could make it, and it's so good to see you here. And it's going to be a wonderful subject, and it's going to be a lot of learning today. And this one is open to public, so I see a lot of names which I am not at all familiar with, and but I see some of my students too. And I'm so glad that you all could make it. And this one we are actually doing it in the middle of the week, because usually we have live webinar for the members every Friday. So that's how we get updated. The course updates run every week. But today, in the middle of the week, we just decided to do one for everyone who would like to join. So welcome aboard. My name is Anila Simon, and I'm the educator with Aaron Coaching. So for those of you who are not familiar with me, I just wanted to introduce myself. All right. Hi. Hi. Good to see you guys here. And of course, you will be able to write down anything you want in the chat window while we are discussing things. And we will go about it. Okay. So let's get started. Okay. So I guess everybody know the topic today is ethical dilemma. And this has been, this has been there in NCLEX for some time, because this is part of legal and ethics, which they ask. But this word ethical dilemma was kind of popping up more often now. So wanted to know about it. And it's very important that you all are really, really familiar and you really know what this means, because there will be questions about ethical dilemmas and what you're supposed to do. So it's kind of a difficult topic, but I'm going to try to make it as simple as possible. And I will try to explain it better so that it will stay there. All right? Okay. Hi, everyone. Okay, hi. There we go. So we are going to, first we are going to talk about why NCLEX is, interested in this topic, why NCLEX wants to ask about this ethical dilemma. We all talk about ethics and morality and moral distress or caregiver stress. So those are some of the terms we use a lot in our nursing daily life. But when it comes to NCLEX questions, they are it will be all application questions, right? I mean, you won't get much of the knowledge questions or understanding questions. It's going to be more of application. So it's very important for everybody to clearly understand what this ethics means, or what is an ethical dilemma. And the reason why NCLEX is more giving specific, like NCLEX is interested in this, is because we do face ethical dilemma in our daily nursing a lot. Okay, sometimes we are aware of it, sometimes we are not. Sometimes we think that, okay, this is, I will just do what is best I can do at this time, and that's it. But those are ethical dilemma situations. So it's very important to understand that on your daily life as an RN in the bedside, or as a charge nurse, or as a nurse manager, or as a school nurse, whatever field you are going to be, you are going to see some of these situations where you have to take a decision. Okay. Now, is there anybody who understand what the word ethical dilemma means? Can somebody type in what they think ethical dilemma is? Anyone? I mean, it's okay if it is wrong, that's fine. But just type in what you think is meant by the term ethical dilemma. What do you think it is? Just go ahead and type in, and anybody can type in, that's fine. And if you don't know, just say don't know. That's fine too. So I will get an understanding that, where I have to start. Okay. So what do you mean by ethical dilemma? Go ahead. I will wait for you to type in. Legal aspects. Okay. That's one way. Anybody else? Go ahead. It's okay. Go. I mean, it's fine if it is wrong. All right. I will still give you marks for trying it out, because that takes courage. Okay. Justin says it's situation where we have to decide. That's true. Gino says it's cultural issues. Yes, it can come. some part of ethical dilemma is with cultural issues. Difficult choices to be made in a situation, true, that is also true. These all are parts of ethical dilemma, but there is one thing which makes it very unique to ethical dilemma. Anything else, anybody? Or let me give you another way. What is the difference between a problem and a dilemma? When you think about it, right decision for the patient, or legal aspects, or situation where we have to make a decision, those are actually problems, right? Or cultural issues, those are problems. And we get problems in everyday life. I mean, whether you are a nurse or not, we get problems. Difficult choices to be made in a situation, that's a problem. But there is a difference between problem and dilemma, or when we say ethical dilemma. And the reason is, in problem, you can find a solution. In ethical dilemma, or when it comes to a dilemma, you have to decide between two not so good choices. In problem, there is one right or wrong. You can do this or you cannot do this. That's how we make a solution. But in a dilemma, there is no right or wrong. Both choices you have is equally bad. Okay, and then you have to decide on that. So when you have a situation where you have two options or two choices, but both of them are equally bad, that's when you say it's a dilemma. And then you just cannot, we as nurses cannot just run away from it, saying that, oh, these two choices are really bad, I don't want to take a decision. But that's not going to be, that's not possible for us, because we are nurses and we always go with the patient's, advocacy. So we have to make a choice. The problem is that there is going to be two difficult, very bad choices we have to choose from. And that's why we say it's a dilemma. Okay, so remember that word, that you have two options, but both of them are equally bad. Sometimes you will get questions in NCLEX where it says, choose the ethical dilemma. Which of these is an ethical dilemma? So you have to know what exactly a dilemma means. Now you know, right? So look for two options which are equally bad. Okay. Now, we do face a lot of situations like that in our daily life as nurses. That's why NCLEX is, giving some importance to it. Another one, we need to know what to do. And also we need to identify if our patients are having dilemmas. We need to identify if our colleagues, our co-workers are having dilemma. We need to identify if we are having dilemma, so that we can go to the right people, or go to the right principles, or go to the code of ethics which is given by ANA, and then we can come up with the best option. Okay, so that's why we need to know about ethical dilemma, and that's why NCLEX is asking about ethical dilemma, because it's going to be one part of us. Now, is it legal issues? Probably, but not always. Okay, legal issues can also come into ethical dilemma, but cultural issues can also become ethical dilemma. So it can be anything. And for a nurse, as a nurse, when we get the license to practice, we are saying to ourselves that we will practice only with ethics. We are supposed to promote ethical nursing practice. We cannot do as much as we please, or what we like to do. I mean, that may not be a good choice, right? So we always have to follow the ethical practices, right? So now you know why NCLEX is, interested, or NCLEX is asking questions about this dilemma. Okay, now let's see about the dilemma here. These are what it's in a nutshell. Okay, this is what it says in a nutshell about the Code of Ethics by ANA, okay, American Nurses Association. So there is a Code of Ethics, and I kind of made it into 6, bullet points where you will be able to understand what this Code of Ethics means. Because if you go to ana.org, okay, you will be able to see the Code of Ethics, and that is a 64-page document. Okay, it's a big document, and it actually kind of tells you exactly what you are supposed to do in an ethical situation, but kind of made it into 6 points. And I think these are the most important things. And if you can understand this, you will be able to decide what to do. Now, in between, I just wanted to let you know, if anybody is having, this my video, if it is, kind of covering part of the slide or something, you have the ability to move it, okay? Drag it to any point. So just move yourself, the video, and you will be able to see the slide, okay? So just saying that. All right. So nurses are ethically responsible for providing safe, compassionate, competent, and ethical care. So that's the major thing we are supposed to do. Anytime there is a patient, and if there is a difficult patient, or maybe somebody who doesn't speak the language, or somebody who actually have some, maybe they are homeless, or maybe there is some kind of errors going on. So whatever it is, we nurses are supposed to give the safe, compassionate, competent, and ethical care. Okay, now that's when we are going to make sure that we report if we have an error. So let's talk about safety. Now, whenever a patient comes, we need to assess them, and we need to do everything which is safe for the patient. Maybe it's fall precaution, maybe it's seizure precaution, maybe it is about identifying the patient with their first and last name, and also with their date of birth, right? Because we are making sure that this is the correct patient. So there is a lot of things we do for safety of the patient. All those nursing aspects will come under your, ethical aspects. Second, you give compassionate care. Okay, maybe there is a patient who is in palliative area, or maybe there is somebody in hospice. Maybe there is somebody who just received a terminal illness diagnosis, and we know what we are supposed to do in those situations, right? We actually, in our course in mental health, we take it for like 1 week. There is in our course there is lessons for mental health, and we talk about therapeutic communication in detail. We talk about end of life care in detail, how to talk to them, how to do nursing management for them. So if you can go into that mental health class, you understand how exactly are we supposed to talk to them, and what is the exact thing nurses are supposed to do, right? So those things are compassionate care, and that is one of our responsibility. Then competency. I would really like you to understand the word competent. Just because somebody has a degree or somebody is a nurse does not mean that they are competent in a specific skill. Okay, so let's talk about maybe maybe about giving, maybe about putting an NG tube. Okay, so because everybody are going through that NG tube process when they are doing fundamentals of nursing, everybody knows about NG tube, everybody knows how to put it, but not everybody be skillful in putting an NG tube. You have to actually demonstrate your skill and get the competency check before you start doing it on a patient, or before we can say somebody is competent in this. So it may be about restraint, documentation. It may be about preoperative care. It may be about labor and delivery care. But everybody has to perform it with skills, and they should be competent enough. So the patients who come, they have the right to get the care from a competent nurse. And that's the standard of practice. Now, if somebody gives you a patient, or somebody assign you a patient about that procedure, after a procedure or something, and you have never taken care of a patient like that, then you are not competent enough. You have to talk to your charge nurse, and you have to probably learn yourself and get the training, get adequate training and skills, and be competent enough before you take care of the patient. Okay, and that's what we talk about, competent and ethical care. If you think you are not competent to take care of a patient, you have to inform your supervisor or your chain of command, because the patients have the right to get the care from a competent nurse. Does that make sense to you? Okay, it's about the rights of the patient. Now, we talk about rights of the patient in legal and aspects in our lesson 1. So that's a very good topic you can go back and refer to. You will learn a lot from there. Okay, and the second one is about promoting health and well-being, which means, doing the best practices. Okay, doing whatever you are doing about the health education or about preventive measures you are going to teach them, or about making them independent to monitor their blood sugar or monitor their blood pressure, or talking to them about exercise or diet, or getting them to get vaccinated on time. So all these things which you are doing to promote the health and well-being of the patient, that we are ethically responsible for. See, I can give you an example. Just take 2 nurses. Okay, let's say one patient, or there are 2 patients who need blood pressure medication. Let's say it's metoprolol. So one nurse is going to the patient, opening the metoprolol tablet and giving it to him and says, here, this is your medication for blood pressure. And the patient takes it, done. Now let's talk about the other nurse. She goes, or he goes to this patient and opens up the metoprolol and gives to the patient and talks about the metoprolol. What are the actions? What are the side effects? What they should look for? When do they have to call the doctor if there is some side effect? What they need to report? Okay, how often they are supposed to take it? Can they take it with food or with water, or how is it that going to be? So all these things she's explaining to the patient and making sure that the patient understood everything. Now, which nurse is actually doing the ethical nursing care? I think you got the idea. Is the second one, right? Now, is anybody looking to see if they are really doing it? Maybe not, but it should come from our heart. That's what we are ethically responsible for. Okay, that is promoting health and well-being of the patient. It takes more time, it takes more effort, but it's worth it. Okay, that's the main thing. The third one is promoting and respecting informed decision making. Now, that's a huge topic. Decision making or informed consent is a big topic, and I won't be able to probably do everything here, but we do talk about informed consent and what are the roles of the nurse and the physician and the patient. We talk about in detail in our legal and legal and ethics class. So you will be able to look at that and listen to that lesson. It's a very good lesson about informed consent, right? So that's a major thing. Like, always remember, the patients have the right to be informed about their care. So if a mentally competent patient is planning to go for a procedure or they are going for a surgery, they have the right to be informed about every aspect of the surgery. The doctor or the surgeon or whoever is doing the procedure should go and talk to that patient and get the informed consent. Okay, now we nurses are simply witnessing the signature. Now there's a huge difference between that. We are not taking the informed consent, we are obtaining the witness signature. The informed consent is taken by the physician. Now, it's a big topic. I won't be able to explain all the differences here. So I would really recommend you go back to legal and aspects, that lesson, and listen to it, because it's very important. And let's ask about that. Okay. Now, the fourth one is honoring the dignity and promoting the justice. Now, in this one, what we are trying to do is we need to give the respect to all the patients. Okay, it's all about their care. It's all about their well-being. It's all about them getting better and independent and going back to a good quality life. Now, if for some reason they cannot go to a quality life, maybe because of a terminal illness, or maybe they are palliative, or maybe they have hospice, if they cannot go into that, then still you have to do everything possible to maintain the dignity of the patient. You cannot just leave them. I mean, as nurses, we cannot leave them unnoticed. If somebody is DNR, that doesn't mean that they don't need any care. We have to give all the care. If somebody is on hospice, does not mean that you don't need to change their diaper or change their bed sheets, or it's okay if you don't close the curtain. No, that's not okay. Whether they are on end of life care, whether they are DNR, whether they are not able to do anything, even if they are whether they are able to communicate or not, it is not going to stop you from giving all you can. It is not going to stop you from giving the ethical nursing care. Right? So that is what is responsible. That is what we are responsible for when we talk about ethically responsible for the care. Okay. And it also doesn't matter who the patient is. I might have differences in opinion about this patient's practices. Let's say there is somebody who is coming for an abortion. Now, I may be personally against abortion. I might have my own values and judgments about, or religious beliefs about abortion. But I have to do a self-check, and I have to stop myself right there, because patient also has the right to choose for themselves. My job or my duty is to ensure that the patient's rights are upheld, or we are always there as an advocate for them. My personal judgment should not interfere with my care for the patient. Okay, so we will talk about ethical principles, and we will talk about this there. It is very important to understand that. As an individual, we might have our own belief system, but we cannot force that on anybody. Okay, it's important to remember that. All right, and we cannot make decisions for them. They are supposed to make their own decisions. Our responsibility is to let them know, or make sure they get all the information, or that they are properly informed, so that they can make a decision. And that's what is called informed decision. Okay, very important topic. Now, another one is HIPAA, and I think when I say HIPAA, everybody knows what it is. It's Health Insurance Portability and Accountability Act, and that's where we are maintaining the privacy, we are maintaining the confidentiality. We are not going to talk about anything about our patients outside the hospital. We are not even going to tell anybody who is not in the care of the patient about our patient. Right? There's a lot of things we need to know to maintain the HIPAA Act, or to maintain the Privacy Act. So that's where the confidentiality part comes in. Like if a patient is admitted, and if somebody calls over the phone and asks you like, oh, how is she doing? What's going on with her? You just cannot give the information, right? You need to make sure that this person who is calling have the right to know. Okay, so that's very important. And that is the Privacy Confidentiality Act. Then the last one is being accountable. And this is where the delegation comes, the responsibility comes, or we are accountable to kind of being competent in whatever we are supposed to be doing. Making sure our skills are updated, making sure we have enough knowledge, making sure we know about evidence-based practices, that we are not following something just because that's how every time it was done before. Okay, because we are the new generation nurses. We have evidence-based practices. We don't do things just because that's how everybody did in the back or in the past. Okay, we have to do things which is right for the patient, best for the patient, and we have research backed up for that. So we have to make sure we know that, right? We have to keep ourselves updated for that. Now, why am I saying all this? Because this is the nutshell of ANA Code of Ethics or American Nurses Association's Code of Ethics, which we nurses are supposed to follow. We are supposed to know about it. When we are licensed to practice, we need to be, we need to have a good understanding of this ANA Code of Ethics. And that's why I'm talking about it now, because if a question comes in NCLEX, NCLEX expect you to know about this. NCLEX expect you to answer after going through all this. Okay, and it's a difficult topic, so I have to kind of make it into a simpler terms. All right. Okay. So are you understanding what I'm saying now? I mean, is this 6 points? Is it clear to you? Because this is something we need to make sure that it's stick here. I mean, you have to get it stuck here so it doesn't go away. Okay. So anytime, good, very good. Thank you. So anytime you have a question, this is where you are going to go back to. Okay. Am I giving safe care here? Am I giving compassionate care? Am I giving a competent care? Because when you know about these things, these 6 points, you will be able to choose one answer. Because otherwise, everything will look like good or everything will look like the same to you. But when you know these principles, and there's more principles we are going to talk about, those are going to help you to choose one option out of the 4. Well, and we know how important that is when you are writing the NCLEX exam, right? Okay. All right, so let's talk about ethical dilemma a little bit more. Like I said, it's an ethical dilemma, is an ethical problem, but you have 2 equally undesirable actions. And when we say undesirable, it's like bad choices. Okay, like it doesn't look nice. It's not a right or wrong situation. It's like there are 2 options, but both of them look equally bad. Now, which one am I going to do? So that's where the ethical dilemma comes. Okay, and our role or nurse's role is to identify each situation and refer to the ethical principles. Because when you know the ethical principles, it's going to help you. It's going to guide you to decide what is the right thing to do here. Okay, and remember, it's not about personal choices. It's not about what we believe as a person. It's about whether we are following the principles or not. Now we are going to talk about the principles, okay, what you're going to use in the exam too. Now, these are the major principles. One is autonomy. Now, I think these, always I discuss this in class and in all the lessons, in the online lessons too. And most of you might be, my students who are already here might be really familiar with this by now. But for others who are, because this is open to public, so I'm just going to talk about it once again in nutshell, and we can do some questions after that. Okay. So autonomy is the first principle, which says each patient, when they are mentally competent, okay, they can make decisions for themselves. If they are an adult and they are mentally competent, they can make a decision. And if somebody is not mentally competent, usually there will be a power of attorney or somebody who can, like a legal guardian, who can make decisions for them. But the important thing to remember is patients have autonomy. Okay, you don't have to agree with their decision. For example, there is a patient, let's say he is, he does not want blood transfusion. We know that there is some religious groups where they don't believe in getting the blood from another person, right? So maybe it's Jews or Jehovah's Witnesses, they don't want to take the blood from another person. So if their religious beliefs tell them that they don't want to take blood transfusion, and let's say now his hemoglobin is 6.2 or 7, and doctor ordered 2 units of blood. Now you are going to this patient and you are telling him or explaining to him about the need for blood transfusion, and that his hemoglobin is this much, and that the doctor ordered it, and this is the best thing for you, and you are explaining everything to him about the blood transfusion, and the patient suddenly tells you, oh, but no, because of my religious reasons, because of my religious beliefs, I don't want to take blood transfusion. Okay, you might be opposing that. I mean, you may not like that. You might know that by getting some blood transfusion, his problem can be, managed well. But if the patient, who is mentally competent and an adult, have decided that he does not want blood transfusion because of his religious belief or reasons, that's it. Okay, the patient can choose for themselves. They have the right to refuse, and that is autonomy. In another example, let's say there is somebody who is with a terminal illness, who is, who actually, let's say there is somebody who wanted to be a DNR. I mean, they did sign the DNR and everything. And let's say after some days of being DNR, let's say he decided to get the full treatment. He decided not to be a DNR anymore. They can do that. As long as they are informed and it's an informed decision, the patient can change their decision. They can make their own choices. You don't have to agree with them, but we have to be there for them. Whether you agree or not, we need to be there for the patient going through their informed decision process. And that's what autonomy means. Okay? It's called Self-Determination Act, or they can decide for themselves. All right, so that is autonomy. Second one, justice. It's a very important principle, very important. Not only for nursing, it's for life also. You have to make sure, or we have to make sure, that each patient have the right to get the standard practice ethical care, like I said earlier. The principles of justice says the patient may be, from a different race, patient may be with a different gender, patient may be having a different marital status, maybe there is a diagnosis, like maybe it's a contagious disease, maybe it's a socially stigma kind of a disease. When there is an HIV or something like that, some people withdraw themselves. Okay, maybe they are homeless, maybe they are a celebrity, maybe they are from a different religion. It does not matter. It doesn't matter where this patient comes from. It doesn't matter whether you agree with them or not. You have to take care of this patient with equal respect, dignity, and competency. Okay? Everybody who comes to you as a patient deserves your best competent practice. It doesn't matter whether they are broke. It doesn't matter whether they are all the way up. It doesn't matter whether they are a male or a female. It doesn't matter which country they are coming from. It doesn't matter whether they are illegal or immigrant. It doesn't matter if they are a male or a female or divorced or widowed or whatever it is. Okay? Whatever it is, you have to treat everybody equal. And that is the principle of justice. Make sense? Now, these are the things you will have to refer back to whenever there is a question about what to do in this situation. There is a dilemma, two equally bad choices. What will I do? Think about autonomy. Think about justice. You will get the answer. Okay? You will be able to make a big decision there. Now, the next one is fidelity. Now, this has been asked many times, so I want you to really understand, and you have to write notes. Okay, please make sure to write notes from all these, because these are really important information which will help you to pass the NCLEX. Now, fidelity means you keep your promises, you keep your commitments. Okay, or you're loyal, you accept what it is supposed to be that it is given to you. For example, let's say Let's say there is a patient who is actually coming out of surgery. Okay, so you got a patient and you got them settled and everything, and then suddenly the patient tells you, and you're doing your assessment, and the patient is telling you, oh, you know what, I'm in so much pain, can I get my pain medicine? And you did your assessment, pain assessment and everything, and the patient is like saying, oh, I have a pain of 8 out of 10. I mean, which is like really bad pain, right? So, and you looked at the chart and you know that there is some pain medicine which is ordered. So you told the patient, oh yeah, wait here, please. I'm going to go you get your pain medicine and I will be right back. Or you are telling the patient that I'll be back in 5 minutes with your pain medication. Okay. Now you have to be back in 5 minutes with the pain medication. And that is principles of fidelity. Now, what happens if you forgot? Or what happens when you got there, you check the chart and you saw that the pain medicine is not due yet? Or you check the chart and you see that there is no pain medicine ordered. Now you have to call the doctor and get the pain medicine, and it's going to take time, right? So if you said you are going to be back with the patient in 5 minutes, you have to be back with the patient in 5 minutes. Now, if you think that you cannot get the pain medicine in 5 minutes because of some reason, maybe because there is no pain medicine ordered, or because there is some other things happened, or maybe the pharmacy didn't bring the pain medicine, whatever reason, if you think you cannot get it, go back to the patient within 5 minutes and tell the patient, this is the problem. I am trying to fix it. As soon as it's available, I'm going to be with you, and be with them. Okay, that is principle of fidelity. Just whenever there is principles of fidelity, or when you hear this term or see this term fidelity, think about promises. If you promise something to somebody, like a patient, do it. Follow through it. Don't ignore it. Don't forget it. Okay, that is fidelity. Does that make sense? Is all three principles, is it clear to you? Can somebody type in if it is clear to you? I just wanted to make sure that everybody understands this. Because, I cannot see you guys. And when there is nothing in the chat, I am like, am I talking to somebody here or am I all alone? Okay. Thank you. Thank you. Nice to see that. Thank you. That's good. Okay. So remember this information, okay? Because it's been asked many times and it will really help you to make a decision when it comes to ethical dilemma. All right, guys, there is some more. We are not done yet, okay? So this is principles of beneficence. Now, principles of beneficence said, do no harm. I mean, it's more like we are going to do only good things to the patient. Whatever is the best thing for the patient, whatever is the good thing for the patient, that's what we are going to do. Okay, it may be, there may be something about their religious belief, there may be something about their feelings, there may be something they wish to do. Okay, but our approach is going to be whatever is best for the patient. We will not do any harm to the patient. Okay, so these two principles actually goes hand in hand, the beneficence and the non-maleficence. Okay, non-maleficence means that you are not going to do any harm to the patient. Beneficence means you are going to do good, only good. Non-maleficence means you are not going to do anything bad. Okay, so those two are actually kind of together, but you have to think about these two options. Now, I can give you an example to see how it is different. Okay. Now we said in beneficent we are doing good to the patient, right? So let's say there is a elderly man as your patient, and let's say he's a little confused. Okay, so he should be on full precaution. Okay, so we got the patient, we got them in the bed, and and we did give him the call bell. Okay, we gave them the call bell, and we told him that whenever you are getting up, or if you want to get up, please call me. Okay, press this call button, and I will be right there. It's actually, we are trying to do all the good things for the patient because we don't want them to fall, right? So that is doing like beneficence principle. But non-maleficence means doing no harm, which means in addition to giving the call bell, we also have to make sure that the patient's, maybe SIL rates are up. Not all of them, but then it becomes a restraint. But maybe the SIL rates are up. We can also make sure that we are keeping all the things nearby, like his water is nearby, his phone is nearby, so that he doesn't have to get out of the bed to get them. Now, if you're not doing all those things, it might be harmful for the patient. Or maybe if you're trying to get him out without having a gait belt or without giving him enough support, he might fall down, and that is, you are doing harm to the patient, right? So that is the difference between beneficence and non-maleficence. Both of them goes hand in hand. They're almost equal. One is doing good, the other one is not making any harm to the patient. No harm. Both are equally important. Now, the next one is veracity. Now, this is the important one. Veracity means you have to be truthful. You have to be very truthful to the patient. You cannot intentionally, deceive or cheat or mislead or withhold information from the patient. Now, I will tell you a difficult situation here, or like we said, it's an ethical dilemma, right? So let me tell you an ethical dilemma. It's a story, okay? So there is a patient who is actually admitted for depression, major depression, okay? Now, we started treating the patient and she actually came out of that major depression. She has been there for 2 weeks in the hospital. She's actually coming out of that, depressive episode. And if you remember about depression in our lesson, you know that most of the patients are more suicidal when they are coming out of the depression, right? When they are treated, when they have the energy to actually do the suicidal plan or follow through the suicidal plan, that's when they commit suicide. So this patient is coming out of that depression. It's a very kind of a risky time. So we have this 101 supervision for the patient. Okay, and she's in a semi-private room, so there is another patient there and this patient, so 2 patients there. And this lady who is in suicidal ideation or suicidal precautions, she comes to you and she tells you that I have a knife under my pillow. Okay, and she's telling you, don't tell anybody. This is a secret between you and me. I have a knife under my pillow. I'm not going to use it, but I just wanted to keep it there just in case the other person, who is her roommate, just in case the other person is trying to do any bad stuff to me. I just wanted to make sure that I scare him off with it. I'm not going to use it, but don't tell anybody. I'm just keeping it under my pillow. It's a secret between you and me. I'm telling you because I trust you. Okay? Now you know the ethical dilemma or the situation. Now you have 2 choices here, 2 equally difficult choices. One, you have to tell the patient that maybe you can, 2 choices is, one, maybe you can tell the patient that I cannot keep that as a secret. I have to let the healthcare members know. We need to get that knife out of there. That is one choice. The other choice is, oh this patient is trusting me so much. I should do, maybe I should not make her feelings hurt by telling everybody. Maybe what I can do is, without telling everybody or anybody, maybe I can just take the knife out. So that way I am not saying, to anyone, I am not, breaking the promise which I am going to give to the patient, but I'm also removing the knife. So you have 2 options there. Both of them looks like equally bad, because if you don't, if you're telling the healthcare team, if you're documenting what the patient told you, and you are going ahead and removing the knife and telling the healthcare team about this incident, you're breaking the trust between you and the patient, right? Now, just the opposite way, if you are not telling, or if you're not breaking the trust between the patient, you're keeping still it as a secret, then you are actually lying because you are withholding information from the healthcare team. And you know you cannot do that, right? So it's an equally bad choices when you think about it. And that is an ethical dilemma. And what is the best thing to do now? If you have to make a decision between these two options, veracity is the principle you are going to go for, because veracity says you have to tell the truth. Now, the truth is you cannot hide an information this important from the healthcare team. The truth is you are going to tell and document this incident in the patient's chart. The truth is you are going to not keep this as a promise. You are going to actually tell people about it. People in the sense, not everybody, just the people who needs to know, the healthcare members, right? So what is the best thing to do? Tell the patient. Tell the patient, hi, miss. I understand your situation, but I will have to tell about this to the healthcare team. I will have to document this. I will have to remove that knife. And that is the truth. Just be truthful. And that's how you decide on what is the best option to do. See how principles of veracity is helping you to decide on an ethical dilemma? And that is what you need to understand. Okay, so that is veracity, being truthful, having that integrity. And it may be difficult given the situation, but it's always better to say the truth. It's easy to say the truth. Okay. Now, the last one is confidentiality, and I think we kind of discussed that in HIPAA. Okay, it's like you cannot give away information about your patient to people who are not included in the care for the patient. And it is also important to make sure that you are not sharing information with people in the hospital or employees who does not need to know about it. For example, let's say there is a patient who is having let's say there's a patient with breast cancer. Okay, let's say she has a metastatic breast cancer, or which means she is probably in a later stage, and let's say she's going to go for a surgery, for mastectomy. So when the transporting person, the transporter who comes from OR to get the patient, transport the patient to OR for surgery, when the transporter comes, you don't have to tell the transporter about the prognosis of the patient. You don't have to tell the transporter about, that this is a breast cancer patient, or she is going to, she is probably going to leave only for this much time, or that it is so spread, I'm feeling so bad for her, or she has kids and nobody is there to take care of her and it's so sad. You don't have to say all that to the transporter. The only thing the transporter need to know is whether this patient fall precaution or not. What are the precautions the transporter needs to know to safely care for this patient during transport? That's all they need to know. You don't have to give any more information, because if you do, you are actually breaching the principle of confidentiality. So don't say things which are not required, okay, even if it's an employee. And another thing is about social media. Do not post anything about your patient or your situations in the hospital in the social media. Okay, even if it is a private message or it's in a closed group, whatever it is, no. Do not talk about your patients or the patient's conditions in social media. Okay, that's against confidentiality principle. Okay, so those are the major things I wanted to talk about today in ethical principles. And is everybody understanding it? Is it clear enough? Because when you get a dilemma, this is where you're going to this should get you as a guideline. These things should pop up in your mind when you get a question in your NCLEX screen, about ethical dilemma. And if nothing, I wanted to ask yourself, is this a safe and compassionate practice? Okay, that's what you're going to ask yourself, and that's going to help you. Let's do one question together, okay? So that we can apply this knowledge, because this is theory. Now it's time for application, and NCLEX is all about application, right? Now the thing is, whenever there is a question in NCLEX, okay, knowing the theory is only halfway. 50% it will get you, but the other 50% you need to understand the concept and apply it. And that's why if you just learn from a book or read notes, it's not going to be enough. I mean, you can get reference books and notes. I mean, even Apple and notes are, people might have it, but that is not going to be enough, because it's all about application, and that you get only from the video classes and lessons where I talk about it, where I teach about it. Okay. So the next one, we are going to do a question together. Let's see who is going to get that. If you have any question, you can type in here. Okay. If you have any question, type here. Now this is the question, but let me say, don't answer here. I will get you a survey. So this is the question, and when we have the question, what I'm going to do is I'm going to give you a survey like this, and you see that there is A, B, C, D, and what you can do is you can click on it and you can submit it. Okay, there's a little button called submit, right? So click on your option and submit it, and then I will get it and we will discuss about it. Okay, all right, here we go. This is the question. The staff nurse is discussing care of a drug abuse client with the new nurse. The new nurse says, this client is constantly requesting pain medicine even before it is due. I just pushed some normal saline instead of morphine this time because it is too early for another dose of morphine, and I wanted to make him feel better. Which action by the staff nurse is the best at this time? Got it? Okay. Option A, instruct the nurse to notify the healthcare provider about the lack of pain relief. Option B, educate the patient about the frequency of pain medication. Option C, document the incident in the nurse's record. And option D, follow hospital protocol for incident report and ethics committee review. So you have 4 options, and this is the question. First, try to understand the question, and then I will let you decide on it. Okay, and I'm going to give you this survey. Okay, and here's the options once again. Here we go. Because some people might need a little bit more time, to go through it. So just see. All the options looks like good options, right? And that's why we say it's an ethical dilemma. Probably you will be able to eliminate 2, and then you'll be like struggling between 2 of them. So just think about it, okay? All right, so let me give you the survey. Here you go. Go ahead and answer it, okay? It doesn't matter if you got it right or wrong, because nobody is going to see your name. It just shows a percentage, and that's it. Nobody is going to see your name. So just go ahead and give your best choice. Okay. All right. So 72% people answered. I mean, that means there are some of you guys who are not answering yet, but that's okay. I think that's enough time. And I would definitely encourage you guys to answer, okay? See, there is nothing which can beat the action of, actually doing it. Okay. So out of 72% people who answered, the most answered one is number 4, which is D, because 39% people answered that. Then there is A, B, and C. Okay, C is the least. Only 6% people said C, but most answered D. So let's go back to the question and let's do this together. Okay, we are going to do this together. All right. So it says the staff nurse is discussing care of a drug abuse client with the new nurse. The client says, the new nurse says, the client is constantly requesting pain medicine even before it is due, which means, it's a frequent pain medication patient probably, because, and they have a history of drug abuse. So they might need, more medication because they have a high tolerance, right? Like if you give some medicine to a drug abuse patient who has been using those kind of medicine for some time, they might require a higher dosage because whatever pain medicine we are giving may not be enough to keep their pain under control. The client is constantly requesting pain medicine even before it is due. I just pushed some normal saline instead of morphine this time because it is too early for another dose of morphine and I wanted to make him feel better. So this new nurse, her intentions were right. She just wanted the patient to feel better. And she knew she cannot give a pain medicine at this time because it is not due. Let's say the morphine was ordered every 4 hours. Maybe it's only 2 hours now and the patient is already calling. And she knows that she cannot give another dose until 2 more hours later. Like it's early. So, but she didn't want to say that to the patient. She didn't want it to make the feel, now, do you get that veracity, the truthfulness, the principles of truthfulness? It is coming up here. Here, when she is giving normal saline instead of the pain medicine to make the patient feel better, that is not ethical. One, she is not being truthful. She is violating the principle of veracity. She's lying. She's lying to the patient that she is giving medicine, but actually she is giving normal saline. And there is a word which we use for that. That's called placebo. Okay, the word placebo, that means you are giving something, which does not have the actual medicine in it. Okay, so it's a placebo, which is wrong. It is not ethical. She is violating the ethical principle of veracity here. Now, there is another element which comes in here. That element is this new nurse is probably having some judgment issue. See, because this patient is a drug abuse history patient, because this patient had a history of, past history of drug abuse, maybe this new nurse is thinking, oh, he's just here for the pain medicine. But you are nobody to judge somebody like that, right? We learned about the principle of justice. It doesn't matter what the medical diagnosis says. It doesn't matter what the patient had in the history. It doesn't matter what is the patient suffering right now. You have to treat everybody equally. Okay. Now, the reason for this patient requesting more pain medicine, maybe it's because his body has been accustomed or tolerant to a high level of pain medication. So his pain is not going away, even if we are giving morphine. Maybe he needs something more higher or stronger, or maybe he needs it more frequent than every 4 hour or 6 hour or whatever it is been already prescribed to him. Does that make sense to you? So that is why we have to refer to the principles and do what is best for the patient, because we are patient advocates and we want to do the compassionate, caring, what is best, the safe, the ethical nursing care to the patient according to the code of ethics. Okay, so in that, if you have this much information, now that I just talked a little bit more about the question, do you think there is a change in your answer? Which one you think is the best thing to do at this moment? You can type in here. It's okay to type in here. Not yet. Not yet. A, yes. A is the correct answer. Okay, A is the correct answer because this is where you are actually taking care of the patient. You're actually taking care of the need of the patient other than judging the patient. Okay, first you take care of the patient. Your first important responsibility is to the patient. First, you take care of the patient. The documentation is the last thing you want to do. It can wait. So you are going to tell the nurse to call the healthcare provider, discuss the situation, talk to the doctor about the lack of pain relief, get some order change or new order or frequency change or whatever, and then you take care of the patient. After that, maybe we can educate the patient about the pain medication frequency. Maybe you can document about this placebo incident in the nurse's record. Maybe you can send it to the ethical report or committee or hospital protocol. You can do all those stuff after you take care of the patient first. Does that make sense? Okay, so that's why it's important to remember the ethical principles. Okay, so I guess it's been 1 hour, so I'm going to kind of stop here. And but I just wanted to give a very great thank you to all of you guys. And also I want you to remember that it's very, very important to do your best when you're preparing for NCLEX exam. Okay, because see, the things are not going to happen just because you need it. You're not going to become an RN because you need to be an RN or because you need a job, because you need the money, or because you need to be proud of yourself. It's not going to happen to you just because you need it. NCLEX RN exam, you are going to pass it when you deserve it. Okay? There is a big difference between needing it and deserving it. So make sure you deserve it. And how do you know you deserve it? When you do everything possible in your capacity to prepare better for it. You are studying well, you are doing all the questions, you are not missing any classes, you are actually going through every video lectures, you are looking at all the questions and doing it yourself, you are giving the time for it. That's when you deserve it. Everybody needs to pass. I know it's easy. It's easy to wish for it, but it's not going to come until a point where you deserve it. So make sure you study smarter. Okay? You might be having all the information with you in your fingertips, but until and unless you use it, you don't deserve it. So be the person who deserves to become an RN. Then you will become an RN. Okay, and I will be there to support you, to guide you throughout. Okay, when you are an Apple RN student, I'm going to be there. And you know that you can ask any question 24 hours through the Apple RN support once you become a member, right? And I will be there every week. Like we do update every week. We have the class. So every Friday, I will see you. Take care and bye-bye.